everyone had a great vacation, because you didn't really have to do anything over vacation, but you know, any stuff that you hadn't done before, basically, you know, catch up on some exams, whatever homework you needed to catch up on, that type of stuff. That's really all you had to be doing. We are on chapters 22, 23. 22 is the hemic, lymphatic, mediastinum, and diaphragm. Last week you were watching a lecture from last session, and this puts us on week 16.
Are you going to go over the answers for 20 and 21?
Yes, I will.
Thank you.
Yep. I did. All right. Yes, we'll start doing the answers for 20 and 21. Let's go ahead and start right in the textbook. And by now, everyone should have gotten their HICPIC book. You'll either have one like this or one that has a spiral bound. Yep. And you should all have your ICD-9 books. They either look like this, or you have a big one with spiral bound. And you should all have your CPT books, which I believe everyone got the ones like this. So, chapter 20 in the textbook, theory and practical. Number 1, anatomic. Can you hear me okay, Angel?
Yeah.
Because I don't want to be yelling. I feel like I'm yelling.
No, it's good. I'll move up if I need to. Anyway, I've got like 5 feet.
2 is endoscopic procedure or endoscopy. 3 is extent. 4 is modifier 51. 5 is diagnostic. 6, indirect. 7, direct. 8 is ear, nose, and throat. 9, integumentary. 10, respiratory. 11, inferior, middle, and superior. And 12, displacement.
Yes.
Okay, then we're going to go into the practical. Number 13. The CPT is 32997 for a total lung lavage. And the ICD-9 code would be 508.2. Now again, do not erase your answers. Put a line through it and put the correct one off to the side. And then if you have questions, you can ask at the end, or when you have time, you can go back and look at those codes to try and figure out why you got it incorrect. All right? And if you can't figure it out, then definitely send me an email or we'll set up a phone call to go over those answers with you, okay? Number 14, you should have a parietal pleurectomy. The code is 32310. The diagnosis code 511.1. Number 15, 32504 for excision of a lung tumor, and the diagnoses 197.0 and 199.1. 16, 30300, diagnosis 932.
Did you say 30000?
No, 30300.
Okay, 303. All right, it's good then.
Yep. 17, 31237 with an RT, and diagnosis 471.0. Number 18, 31530 with diagnosis 933.1. Number 19, 31510, diagnosis 478.79. 20 is 30000 with a diagnosis of 920. 21, 31070 with an LT modifier and diagnosis 473.1. 22, 31287, diagnosis 461.3. 23, 30520, diagnosis 738.0. Number 24, 31625 and 32480 with diagnosis 162.3.
Boy, that's great.
Number 25.
I had it right and second guessed myself.
That's how we. That's honestly how we. Most of us get it wrong is because we second guess ourselves.
I write it down wrong.
Yeah.
For 22, I had 416.3.
Yeah. So 25, 31255 with an RT modifier. Diagnoses 473.2 and 471.9. Did you have them in that order?
I had 473.2 and then 471.9 for some reason.
That's correct. 473.2, then 471.9.
1.9, yeah.
Yep. Did you code the 31255 correctly?
Yeah, with the RT behind it.
Okay, perfect. All right, number 26, you should have 30901. Diagnoses 784.7 with 401.1. And let's go right into chapter 21 and then we'll go into the work. Okay, so 21 practical and theory.
I had a question. When I was reviewing the video that you sent us, there was some of the stuff in here that throughout the chapter for the code. Should we go in and put those in, that the ones you didn't cover in our book for the CPT?
When you mean highlighting and stuff?
Yeah, like there was a few codes that you didn't go over in the video, because the one I got was last year's, it said, and so I was wondering, there was a few things that didn't get discussed in there. Should I add them to my CPT code book from the regular book? Okay.
Yep. Okay, 21, theory number 1, heart and pericardium, arteries and veins. Number 2, cardiology. Number 3, surgery, medicine, and radiology. It can be in any order. 4, invasive or interventional. 5,
Intervention.
interventional, yep, invasive or interventional.
Or intervention. Had the invasive, but.
Yep. And 5 is non-invasive. 6 is electrophysiology. 7, nuclear medicine. 8, selective. 9, non-selective. And 10, percutaneously.
It's
11, number 11. You should have 99215 with a modifier 57 and 33430.
what was the 992? What was the rest?
15.
15. I didn't get that one right for some reason.
So what did you put in place of it?
99219.
Okay. Do you know what the difference is?
No,
So
because I
look
went
'em up.
over the
Look them up and
E&M,
tell me the difference.
and you said it was 99215.
Right.
Oh, because he only had 2 of the components. I was counting the workup and analysis as the 3rd component.
Yep. So how are you feeling with your E&M codes now, Angel? Any better?
A little bit, but I'm still not sure what to count toward it. I know always that you count up, the history and the physical, and usually what type of health they're in for a standard, but from there I'm kind of getting confused, like if you count labs or
You
information like that.
You can, but it's really the encounter, the history and physical, and then the decision making. So the labs included in that because they are a part of the decision making.
Okay, yeah.
Okay,
And that goes under decision making. Okay.
but it's really your review of systems and the type of history that you take, which makes up the big component.
Right.
So the diagnosis code for number 11, you should have 394.2. Number 12, what did you have for 12, Emily?
35876.
It's actually 35875. So I want you to look up those 2 codes for me and tell me the difference.
I had the with revision of arterial or venous graft.
Okay, so you
Why did
had,
I do that?
could have been late at night, it could have been you didn't read it clearly. Those are all different things. Okay, So number 12 is 35875. Number 13, 35141.
Could you repeat that one?
I'm sorry, number 13, 35141. Number 14, 33514 with a modifier 80. Why do we use the 80, Emily?
I don't know because I got that one wrong.
Okay. Angel, why do we use the 80?
That's 14. Oh, because there was an MD that had assisted, so it was 2 people involved.
Perfect. Good job. And the diagnosis code is 414.01. Number 15, 33425. Number 16, 33241. Number 17, 33020. Number 18, 33697. Nineteen, 33750. Diagnosis 745.2. Number 20, 33916. Number 21, 35005. Diagnosis 442.89, 433.20. Number 22, 35351. Diagnosis 444.81. Okay? Any questions with any of those? How did you feel doing the homework?
Good, except for that I make stupid mistakes. So
Okay.
not stupid, but just careless mistakes that that's the only kind of frustrating.
Okay, how about you, Angel?
I just started this page. I had the rest of it, but I didn't have a babysitter last week. My babysitter had vacation.
Okay.
A 2-year-old and a 7-month-old just didn't get much done.
Yep, I
But I'm caught up.
understand. But how do you feel about what you did get done?
I think that I understand it. It seems like the E&M I'm kind of not understanding as well.
Okay.
Yeah.
Okay.
You know, where to file it under. I was reading through and it said it was you knew you were at the hospital for 5 days, so I didn't know whether I had to do the admission or the discharge only. That confused me.
Yeah. And I think with that one, wasn't it an inpatient E&M? Was that what it was, an inpatient E&M?
That established, and they were at the hospital for
Right.
5 days. Yeah, for recovery after the mitral valve replacement.
Okay. All right, let's go to the workbook. What page in the workbook?
123.
Page 123 in the workbook, chapter 20.
And I have all them ones done.
What?
Other than, it stumped me once again on the reports. I just went around and I couldn't do it. I just kept going back to it. I was just getting more frustrated.
I didn't get the reports in 20 either. So
Okay.
that part I didn't do.
So did you do 21?
Yeah, I think I did the reports in 21 too.
Okay.
Yep.
All right, so 20. Number 1 is D. 2 is H. 3 is K. 4 is O. 5 B. 6 N. 7 C. 8 G. 9 F. 10 P. 11 M. 12 I. 13 A. 14 L. 15 E. 16 J.
I absolutely hated this, but I did good on it.
Good. All right. Now I'm usually just doing the even numbers because you have all the odd numbers in the back of the book. 18 is rhinoplasty. 20, ablation. 22, lavage. 24, it's no because your procedures are bundled. The chest tube is actually a separate procedure and it's bundled into the thoracotomy. So 32551. 26 is a bilobectomy. I like this chapter for those big long words. 28 is a 31511. 30, 31623. 32, 30100. 34, 30400. 36, 30220. 38, 31611. 40, 31579. 42, 31750. 44, 32554. 46, 32854. 48, 32815. 50, 31050 with diagnosis 461.3. 52, 31625 with a diagnosis 786.2. 54, 32604, diagnosis 393. 56, 31766, 162.2.
Thank you.
58, 30125 with a diagnosis 229.8. Your reports. Let's look at report number 60. Number 60, which is report 21. Did you do that one, Angel?
No, I started, but I had to look in the back of the book and I wrote it down how they did the steps, but I wasn't comprehending. You know, I knew
Okay.
where to find it for the CPT code, but to go from there, I didn't know what to do.
So you did the CPT. What'd you find?
I had 31624.
Okay.
And
Did
then
you
for
have?
some reason I wrote dash 31623 dash 51. I don't know how.
Because there's two. Okay.
Oh.
The first one is the lung lavage for the bronchial,
Oh, okay.
and then the second one.
They didn't have a line there, so I didn't know if I was doing it right because I was looking and I'm thinking I only had one code. It should have been not two.
No, you're supposed to have two. The second one is for the brushing, the bronchial brushing.
Yeah.
Okay. And they told you right there, brushings, washings. Okay, so you did that right. And then what'd you have for a diagnosis code?
I didn't find that one. I
Okay.
went under the lavage and I went under bronchial and I just couldn't find it. I went around and around.
Okay,
I'm not
what you
sure.
have to
Find it in the ICD.
what you have to remember is that your ICD-9 codes are going to be totally separate from your procedure. Okay? Your procedure tells you it's a CPT. Your diagnosis tells you it's an ICD. So their diagnosis was mildly inflamed airway with some thick secretions, no definite mucus plug was seen, and certainly no cancer was noted. The pre-op was atelectasis of the right lower lobe, suspecting either mucus plug or obstructing cancer. So we're going to question right away if it's a tumor. Is it some kind of tumor? What is a tumor? A tumor is
When
a
you're-
neoplasm.
Yeah. When you're looking for that information, you're going for, in the report, you're going for the most worst thing that could happen. Is that what? I'm just not sure what to look at. You know, I know there's the neoplasm. I knew there was the phlegm and stuff like that, but I don't know what to pinpoint for a diagnosis after that.
But that's it. You had it. You're just overthinking it. Which you are, because it says right there, obstructions, mucus plugs. What does that make you think of?
Phlegm.
Okay.
That's all I can think of.
But when we've got to put on that thought about, okay, it might be a mucus plug, it might be a tumor. What is that? That's a neoplasm.
Mm-hmm.
That's the type of training we have to do for ourselves. We have to kind of drill it down to, all right, how am I going to find this in the diagnosis book?
Mm-hmm.
Okay?
I know how to get it's just I don't know.
So this is that detective work that we're only going to learn by training ourselves to start thinking about, okay, how am I going to think about this? Where am I going to find it? Remember, I told you, Google is going to be your best friend. If you don't remember what atelectasis means, look it up. Google it. When you find out what it means, where can you put it in your book so you're going to have a reference?
Mm-hmm.
Okay? So we would go to neoplasm of the lung.
Looking for my report still. I'm lost here somewhere. Okay. Could you tell me what page that's on for the report?
222. 222 in the workbook.
Okay. Oh, I'm looking for the reports. Oh, and that is one. All right. So they said he had, the person had atypical cells.
Yep.
And unspecified, right?
Right. So
Typical unspecified.
yep, so uncertain behavior.
Okay. Uncertain behavior.
So we should be looking for a neoplasm of the lung under uncertain behavior.
And it's not under bronchial. I don't see lung. It's not under lung.
Neoplasm, lung. Did you look in your neoplasm table?
Yeah, I'm in the neoplasm.
Okay, so then under lung.
I didn't go far enough. Hold on. I'm not finding lung for some reason.
Emily, where is it?
It's 235.7. I don't know
What page?
I have to go back and find it.
Got lip link.
No, it's
No, because you want to find it, you can't find it, right?
1,406.
1,456.
Oh, okay, yep. Neoplasm of the.
Okay?
Yeah, hold on. Yeah. Uncertain. So it's 235.7?
Yep.
That's right. 235.7.
Okay, number 62, report 24. Okay, report 24 is on page 224 in your workbook. So the procedure is a fiber optic bronchoscopy, bronchial biopsy, bronchial washings, bronchial brushings. Pre-procedure, abnormal chest x-ray. Post-procedure, inflammation in all lobes. Pneumonia with pleural plaque consistent with possible candidiasis. Emily, what'd you have?
I didn't do that one.
So tell me how we would start.
That's what I'm trying to think of.
Okay, so procedure performed just right off the bat is what?
The bronchoscopy.
Right, the bronchoscopy. So start with that.
I was gonna say
And what are they
bronchoscopy.
doing in the bronchoscopy?
They are doing a bronchial biopsy.
Yes.
And the brushing.
So start with the bronchoscopy biopsy.
Which one are you doing for a number?
Report number 24, page 224 in your workbook.
It's where
I tried 23, but not 24.
Well, the answers for the odd numbers are in the back of your book.
Okay, yeah, I'll look. And
That's why I give you the even numbers for homework.
so you can look up bronchoscopy.
Okay, what do you have?
I don't think it's 2. Because I know it's not right. I don't think.
What's your answer?
90% sure. I have 31717. I don't know why I keep going back to that.
What does it say?
Catheterization.
Why are you doing a catheterization when
I
you're doing a
don't
bronchoscopy?
No, it's the closest one I
So
can
you need to look
find
up
back here.
bronchoscopy. What's a bronchoscopy?
The bronchos- I'm in the bronchoscopy. I just, once I get down in
Okay.
there, I don't know where to go from.
So what are they doing in the bronchoscopy?
They're doing the bronchial biopsy.
So start with that. Bronchoscopy, biopsy. What is it?
Hang on, now I'm lost. 316. Oh, okay.
What is
See,
it?
I was going too far, but I don't. Now I have to figure it out. Would it be 31623?
Close. 31625 is your first one. Look
Yeah.
at that. And 36123, modifier 51, is your second one.
Okay.
Because you're doing the biopsy first. Remember, you're doing what we call the most intensive work first.
Yeah.
And then you're doing the other stuff. So in this case, they're doing the biopsy. So they're going in, they're getting the biopsy, and then they're doing the brushings.
See, I was going right to the what was it? The bronchial brush biopsy. That's what I was going to instead of going to biopsy.
Right.
Bronchoscopy first. I don't know why.
Well, they've got to do the biopsy first,
Before.
and then they're going to do the brushing.
Mm-hmm.
Because it's kind of like they're cleaning up after themselves.
Right.
Okay? That's why you would think of it that way.
That's my.
So you have to think of the order of the procedure,
Yes.
and the most intense goes first
Yes.
and leads up to what
Yes.
follows. All right.
Because if you think about it, also, the biopsy is what we would consider to be not only the most intense, but the what could lead to something. You know, if they took too much of a biopsy, they could cause more bleeding. All right, because they're doing a fiber optic one, so they're putting a scope in there, and then they're putting this little snare tool in through the scope to pull out the biopsy, and then they're putting the brushes in to do the brushing and clean the area. So they've got to do
Way to
the
mess up.
biopsy first. Okay, so think about, okay, how am I going to do this? And try to think.
Frustrating.
It's,
I like
it's
it.
like
That's
putting a puzzle together. You know how you sit there and you lay out all the pieces and you try and do the border first, and you're looking at the box and you're seeing if you can group certain colors. Same thing with your exercises. Think about, okay, I'm the physician. How am I going to do this? How would I do this? Okay? And then the diagnosis code for this would be pneumonia, which is 486. All right. 21. We all set? 21. 1 is E. 2 is G. 3 B. 1 is E. 2 is G. 3 is B. 4 J. 5 D. 6 H. 7 A. 8 K. 9 I. 10 C. 11 F. 12 C. 13 J. 14 F. 15 D.
Oops. Could you go back to 12? And I got lost after that one.
C.
C. Okay.
13
Thank
is
you.
J. 14 is F. 15 is D. 16 is K. 17 I. 18 A. 19 H. 20 G. 21 N. 22 M. 23 B. 24 E. 25 L. 26. Pericardiocentesis. 28. Pacemaker and cardioverter defibrillator. 30 is 78. 32 is yes, because the service is unrelated to the implantation. 34, aortic, mitral, tricuspid, and pulmonary. 36, coronary. 38, irreversible. 40, contrast material. 42, 33405. 44, 33501. 46, 92960. 48, 92950. 50, 35601. 52, 37660.
You say 660?
37660. 54, 33533. 'Where the diagnosis?
54 again.
33533. Diagnosis 41406. 56, 35251. Diagnosis 90211. 58, 35190. Diagnosis 904.8. 60, 33822. Diagnosis 747.0. Number 62 is report 25. Did both of you do those?
No, I don't know why I didn't do these.
Okay. So let's look at report 25. Report 25 is on page 224. What are they doing for a procedure? It says procedure performed, left-sided heart catheterization, selective coronary angiography, and left ventriculography. It's pretty clear. What are they doing?
Catheter. It's a catheter.
Catheterization. So go ahead, look it up. Catheterization. Catheterization of what? The heart. So we're going to
Heart.
start with the heart. And look up heart catheterization. So start with heart. I don't like them.
You don't like them?
Not those tabs.
I like them.
That's why I did this.
Did you ever put a picture online of your? I need to do that
God.
because I haven't finished. I have these tabs. I bought big ones. And I haven't tabbed mine.
Oh, you can use the big ones too, but it's harder to use the big ones on the book like that.
Really?
Yeah.
Like just like these ones.
Those ones are better.
That's what I wanted to put in this part.
Yeah. Did we take a picture of this book?
I think we did.
Okay. What did you find, Angel?
I'm still looking.
Okay, did you go to heart?
Yeah, I'm at the endovascular repair of descending thoracic aorta. I was
All right,
just-
hold on.
section
Hold on.
203 page. Okay, we got introduction to guide wires. Left side.
So when you go to heart, it tells you to go to cardiac catheterization. And then from there, you should be able to find it under, what is it, left-sided? Do they tell you?
It says,
Left-sided, right?
is it 93458?
It is.
It is?
It's 93458.
Wow. Okay, I thought it was wrong for one.
No,
That's awesome.
perfect.
I don't know, where are you looking for the heart and that's at
Okay.
I had to go to Cardi.
So you went into the back of the book under the index, right? And when you looked underneath heart and you looked at catheterization, it told you to see cardiac catheterization. So you went to page 773 and it says cardiac catheterization, C, catheterization, cardiac. All right. And then it says combine left and right heart with left ventriculography. Combine right and retrograde left congenital cardiac. So you just keep going until you get down to where it looks like it's the exercise. So we have to go all the way down to where it says left heart underneath cardiac catheterization. So left heart, what? With ventriculography. Okay? So they give us four or five codes there to look at. 93452, 93458, 93459, and 93565. So then we go and we look at those codes and figure out which one is the most appropriate.
Okay.
Okay? And as you should have 93458, modifier 26. Why? Professional component.
That's fine. Because
a catheterization takes place usually in an operating room or the radiology department back in their suite where they have the table all set up for the patient, and it's usually physician. The radiologist does it. Yeah. Okay? So then your diagnosis for this, they tell you the conclusion: normal overall left ventricular systolic function, severe single vessel atherosclerotic heart disease, angioplasty stent of the right coronary artery. Now obviously you're going to have to go through and read the rest of that, but your diagnosis that you would go for would be arteriosclerosis of the coronary artery. So it would be 414.01. Where'd you hide it, Angel?
I know. It's been a bad week. I've had to have my car jumped every day to get the kids to the babysitters.
Yes, everyone's had that problem. Ours just died.
I didn't realize that I was supposed to look in the index. I've been actually looking it up by knowing what the topic was and going under that section. That's why I was looking that way.
You poor woman.
I must have missed that class because I think I got 17 and 18, but I missed one of them things, and that must be the one that this was in.
Yeah.
Well, I did them all right though when I was correcting it. So
good job. Okay, so then report number 64, or number 64, which is report 27. Report 27, this is an operative report. Symptomatic right internal carotid artery stenosis. They're telling you that the operative procedure is a right carotid thromboendarterectomy with patch placement. Intraoperative electroencephalogram monitoring. So they actually have two procedures going on here. What's the first one?
the
Thromboendarterectomy. Thromboendarterectomy. So look that up. Endarterectomy or thromboendarterectomy. And what is it of? The carotid artery. You either love this chapter or you hate this chapter.
No comment.
There's no in between. I actually love this chapter. I just don't have enough time in a day to go find some cardiac office that would allow me to shadow for a little while. That would probably be my next type of coding is cardiac.
Nice. You go, girl.
Yeah.
That's definitely the last on my list to apply. Correct. Before 001. So is that 34001?
It's actually 35301.
Okay.
35301. So look it up.
I was looking right at
Yeah, I'm under carotid, and then I went under the throm. Maybe I spelled it wrong. 35341.
35301.
01.
The only part that confuses me is that I don't, unless I'm not seeing it, is the right side part of it.
3534.
You know what I mean?
You don't need to worry about right side, just the fact that it's thromboendarterectomy of the carotid artery.
Okay.
Because your operative report says right side.
Okay.
As long as it's somewhere.
Okay. That was the part
If
that
it's
was
not
throwing
in-
me off. Why I didn't think that was the right one.
If it's not in the top part, then you need to make sure you put RT.
Okay. Okay.
But usually when you have paired organs, you don't need to do RT and LT. And then the second procedure is going to be what? The electroencephalogram, right?
Yep. So it's 35301. Lost that pen again. I figured out I need like a bookmarker.
Well, when you are taking the national exam, you're better off having a bunch of extra pens and pencils or some sticky notes, something so that you can put them in between the pages
Nice.
while you're coding. And you might even want to try it now while you're doing your assignments, when you're doing your homework.
Okay. 3540.
Okay, what did you come up with, Emily?
I had 9
What'd you have, Angel?
I'm still looking.
Okay.
I trust her.
Okay. Am I going to use a modifier?
You would.
Yes or no?
Yes.
Why?
I don't know. You said something, so I know I need one.
Because it
It's the part
is.
that I can't get into my head.
Because it is professional component.
I need to just drill that into my head. That's the part that I just get stumped on every time.
So for the first code, you should have 35301. The second code is a 95955 with a modifier 26.
So when you do that, like to write it out, do you do them like right back to each other with like a dash or?
Yeah. With
I
one
just
dash.
weren't sure how to put it
Yeah.
together.
Yes.
Could you repeat that one again? I couldn't find it, but I looked it up.
35301
Yep.
and 95955-26.
And that's the modifier.
Yes.
So you would do like the 35301-95955-76
No.
when you're writing it out. You do them back to each other. How? Do you have something you could show me or send me something?
Your first line would be 35301.
Okay.
Then on the next line, you would put 95955-26.
Okay.
All right, what would we put for our diagnosis code, Emily? How would
Sorry,
we look
I
it
was
up?
busy. We would. Stenosis.
Yeah, and what is stenosis? Stenosis is narrowing. Narrowing of what?
The right internal artery.
So narrowing of the artery, which artery? The carotid artery. So look up that diagnosis code. Narrowing of the artery, which one? The carotid artery. So tell me what page you're on, Emily. Walk me through it. How am I going to find it?
I'm on 1437 narrowing.
1437 in the ICD-9 book.
Yep.
Narrowing.
And then it has. I'm looking at the wrong one. Trying to find it. It's as far as I've gotten. Oh, I see it.
Okay, so
So
where is it on the page?
I was looking at narrowing on the beginning. It's at the bottom of
What page?
1437. It has the carotid.
So page 1437 in your ICD-9 book.
It has 433.1.
Okay, we have narrowing. And we have artery, coronary artery, carotid, All right, 433.1.
One.
All right, and then we're going to go into the tabular and make sure we've got the level of specificity that we need. So go into your tabular and then tell me what is our code.
Are you talking, you're looking for the CPT code or?
The ICD-9 code.
It was the 433.1?
Right, but we want a higher level of specificity, so
So it would be 433.10.
yes, 433.10.
Okay, how did you get the 0?
Tell her how you got the 0, Emily.
They include and exclude at the top.
There's an includes or excludes note at the top of the section.
Without
All right. Yeah, okay, I see. I just hadn't flipped the number yet.
That's okay. All right, and that should answer report 27. So any questions on those two chapters? No questions? All right, let's go. Right into chapter 23, which is our digestive systems.
Are we going to do 22 on our own or?
Oh, sorry, I meant 22.
Yeah, you were confused.
I'm looking right at 22 and I said 23. I apologize.
I was confused, and I don't know why I'm confused. I just couldn't remember for some reason. Are we supposed to do the book work and workbook for 22 and 23?
If you did, yes. If you didn't, fine.
Okay.
Yes.
Well, I did it because I couldn't remember.
Yes. Normally, you read and do the exercises for class.
Do the test.
If we have a chance to go over the exercises in class, we will. If you don't do the homework for class, then you end up having to do it afterwards.
Okay.
I do ask that if you're going to write the answers down because you didn't do the homework, at least write them on a separate sheet of paper so that you can look them up afterwards.
Yeah, I was just
Okay,
making
or
sure I was
refer to them afterwards.
caught up.
Yeah.
So I did it right.
Right.
Because I always take the test after class or the next day. After
Right.
you've gone
Take the
over
test
work.
after
Sure.
class because there really isn't any right or wrong way to do this. It's however you learn best. Okay? So if you come to class and you've done nothing at all, you're just going to have a little harder time because you're not going to be on the same page with your peers. All right? But some people learn better by hearing the lecture first after they've read the homework and then going back and doing it. Okay?
That's what I'm finding works good. I went over the book, because the heart was really bad, and then I heard your lecture after I read through and I understood it better.
Yes. And that's why I said in the beginning, at least read everything before you come to class so that when I talk about it, you have at least read it and it will click when you hear it. Now, if you do the exercises within the chapter and for whatever reason can't figure out why they came up with the answer they gave you, I want you to come to class and ask why, if you truly, don't get it. The same thing with the theories and the practicals and the workbook. If you don't understand why they give you an answer that they give you because you got something else, let's talk about it, because that's how everyone is going to learn. All right. There are sessions where, believe it or not, I have 1 or 2 students who are sending me emails all the time. And then there are other sessions where I don't have any questions. So it's hard to gauge how everyone is learning, because everyone learns so differently.
Yeah, I'm getting the current procedure stuff. I love doing that part. I wish they just had a job for that.
Well, that's the billing part. You know, that's the billing part.
But my math sucks.
Well, I have to tell you that, you know, people wonder why I do what I do, because I am not a math whiz, but I love numbers.
Numbers, that's me.
Okay, I can balance a ledger and, you know, do all of that stuff, and I can tell you why you owe what you owe, but don't ask me to go above and beyond that, because I can't.
Mm-hmm.
I can figure out, you know, allowed amounts and percentages of that type of stuff, but when it comes right down to all of the algebraic equations, and don't ask me to do that. That's what my kids are for.
Yeah. The computer. Want to figure it out.
Exactly. So with chapter 22, we're on the hemic and lymphatic mediastinum and diaphragm. What you're going to see, let's open up your CPT book too at the same time so we can do some highlighting and underlining. So page 244. And yes, this would be a good time that if I had to recommend any class to review, any lecture to review, it would be the cardiac one. So if you ever wanted to re-listen to a lecture, the cardiac one would be the one I would listen to again, just to hear it again. Okay? So we're on page 245 in our CPT book and page 643 in our textbook. The hemic and lymphatic systems, you're going to see that they have subsections. So the spleen is actually a subheading. And when we talk about excision, repair, and introduction, that is a procedure. And those procedures are the subsections. 245. That's your 245?
No, I'm just not thinking because I'm looking at 645. Thank you. I'm sorry.
245. Okay.
That's what we get for vacation.
Sorry.
Yeah, I didn't
It's hard
have
to
a
get
vacation,
back on the.
so-
It's hard to get back on this. Like you said, I was staying up to like 12, 1 in the morning to do what I did. To get back up at 5:30 with the little one.
Crazy. You know, ladies, we only have 4 more weeks left.
Well, that's what I was looking at the syllabus. I'm like, oh my God.
Yeah, we only have 4 weeks left. Okay? So it's going to go quick from here. For whatever reason, it goes quick. So when we get into the systems from here out, and this is about that point where we start getting into more excisions, more repairs, and introductions. okay, you're going to see that the chapters, they start dividing by procedure, and then they divide by anatomy. So in this, you're going to see that the first division will be the spleen, all right? Then the next one is general, and then you'll see lymph nodes and lymphatic channels. And if you look at figure 22-1 in your book, you're going to see all those lymph nodes and lymphatic channels. All right, they have a really good diagram. And again, if you have anatomical illustrations in your ICD-9 book or your CPT book, make sure you just put a note to yourself what page they're on. So if you need to refer to them and make notes to them, you can do that.
I coded them on the top of my book, so I can just push back to them.
Exactly. So the spleen, you'll see the codes are 38100 through 38200. And your spleen is easily ruptured. It causes massive hemorrhage. You might actually require a splenectomy. And a splenectomy is either total or partial. So right in those first few codes, I would highlight or underline total, partial. Underneath repair, underline with or without partial splenectomy. These are often done as part of a more major procedure. So they're going to be bundled into the major procedure. And you might want to put a note off to the side, bundled into major procedure.
And that was under repair?
Just in general, yes. And then underneath your general codes, 38204 through 38243, these codes are divided based on aspiration, biopsy, harvesting, transplantation, and infusion. You'll also see the types of cells. Is it allogenic? What's allogenic? Allogenic means a close relative. If you have to make that note above the word in those code descriptors, do so. Allogenic, close relative. Autologous. Autologous is the patient's own. And then we have HPC, which is also hematopoietic progenitor cells. I hope I said that right. If Amy's listening to this, I hope I didn't batch it too bad. And what is HPC? It comes from the bone marrow, peripheral blood apheresis, and umbilical cord blood. Then for your codes for the lymph nodes, 3H300 through 38999. There are two types of lymphadenectomies. There is a limited, which will be for the lymph nodes only, and then radical, which are lymph nodes, submandibular gland, and the surrounding tissue. When we use the term complete, it means the same as radical neck dissection. So somewhere next to radical neck dissection, write complete.
Where are you at? I'm lost.
Underneath the codes 38300 through 38999.
Okay.
There are two types of lymphadenectomies. You have limited and radical. So when you see those words, those are what I would highlight. When you see radical neck dissection, that also means complete. Or if you see the word complete, it means radical neck dissection. This is where that diagram in your textbook comes in really handy. Even though you can't have it with you in the national exam, review it. Have an idea of what it looks like. So if you get those kinds of questions, you'll remember. Or have a picture in your mind. So what you will also see here are the submental and submandibular nodes, which is the chin area and below the mandible. You'll have the upper jugular nodes that are at the mandibular angle in front of the sternocleidomastoid muscle, which is this part right here. Then you have the middle jugular nodes between the hyoid bone and the cricoid cartilage. You have the lower jugular nodes between the cricoid cartilage and clavicle. Where's your clavicle?
So
The posterior triangle nodes are divided into groups. Your upper visceral nodes are by the hyoid bone. And then your superior mediastinal nodes are between the common carotid arteries. When you see the 38700 and the 38720 code, these are your unilateral codes. Now, if we look at 38724, this code should be a modified radical neck. Is that what it says? This is where they are removing all of the lymph nodes routinely by radical neck dissection while they preserve the internal jugular vein, the spinal accessory nerve, and the sternocleidomastoid muscle. This also is a unilateral procedure. You don't have to write that all in there because it's part of the code. It's part of your code descriptor. Okay? You will also find that your lymphadenectomies are often bundled into the more major procedures. You do not want to unbundle and report them separately. Okay? Your mediastinum. Your mediastinum is the area between the lungs. They show you in your textbook, figure 22.3, the mediastinum. Again, find your anatomical illustrations in your books and make a note where to find them. With your mediastinum codes, the range is 39000 through 39499. What you will find is that these codes are assigned by approach. The incision codes are for foreign body removal or biopsy. Your excision codes are for removal of cyst or tumor. And then you have endoscopy and repair. So your approach here, body removal or biopsy, excision, endoscopy, and repair. So far, so good? Okay. Underneath diaphragm, the code range not 39501 through 39561. The only category here is repair. And it's usually codes for hernia or laceration repairs. And you will find that the codes are indexed in the CPT manual under diaphragm. And let me take a look at the CPT book, make sure we have all the notes I want you to make. On page 245, for your codes 38207 through 38215 in your book, put a bracket, make a bracket around those codes, 38207 through 38215. And my note here that I have is that you only want to report these once time daily.
So 38207 through.
38207 through 38215 only report one time daily.
Thank you.
On the next page, 246. Code 38221, highlight biopsy. And I already told you for allogenic, write relative, for allologous, patient's own. On page 247, code 38300, highlight simple. 38305, highlight extensive. 38380, cervical. 38381, thoracic. 38382, abdominal. Code 38505, highlight by needle. And highlight the parenthetical note. If imaging guidance is performed, see 76942, 77012, and 77021. Over on the next column, 38510, open cervical node. 38520, open, open, open. All of those codes open. Put a nice red star or asterisk next to the parenthetical note for percutaneous needle biopsy. For code 38542, highlight dissection. 38550, excision. Code 38562, highlight limited. And right next to it, lymph node only. Lymph nodes only. Over on page 248. Right next to the heading there, radical lymphadenectomy, radical resection of lymph nodes. Write nodes, glands, and tissue. This is what they take out, nodes, glands, and tissue. For code 38720, highlight complete and write same as radical. (38724), highlight modified and write unilateral procedure. And 38740, highlight superficial and write surface. On page 249. Now, if you recognize all of these things I'm telling you right now to do in your book, I just talked about. So, mediastinum on the right. What is this? This is the area between the lungs. So I would write area between the lungs. What is incision? Incision here is removal or biopsy. Removal of what? Foreign body. And what type of approach? Cervical. (39010) is transthoracic. Next to excision and resection, it would be removal. (39200) resection of cyst. 39220 resection tumor. 39400 biopsy. Next to diaphragm, this is a wall of muscle that separates thoracic and abdominal cavities.
I didn't get the last part. I got wall of muscle separates thoracic
And abdominal cavities.
abdominal.
Underneath repair, this is for lacerations and hernias. Next to 39501, you want to make yourself a note: type, age, and approach. Turn the page to 50. 39503, highlight neonatal diaphragmatic hernia. 39540, highlight hernia and acute. 39541, highlight chronic. 39560, highlight simple repair. Highlight complex repair on 39561. So again, if you have anatomical illustrations here in your book, use them to make notes. All right. Go to 23, digestive system, page 653. Turn to page 255 in your CPT book.
So we're not going over the answers.
I'll go over the answers afterwards.
Okay.
We'll save those for last just so we can get through the work first.
Right.
All right, digestive system. All right, with the digestive system. So what I'd like you to try and do here is follow along in your CPT book instead of your textbook. Your digestive system is divided by the anatomic site. Basically, starts at the mouth, goes down through to the abdomen, the peritoneum, and the omentum, and the organs, and the whole digestive process. Basically, from your lips down through your anus. You're going to find a lot of bundled procedures in these codes. You will have surgical procedures for open and endoscopic. We have the mouth and related structures. We have the pharynx, the adenoids, tonsils, esophagus, stomach. This is how this part of your CPT book will be divided by anatomic site. So it's appropriate that it starts with the lips. Why? That's where it all starts, right? Through the lips. So the first codes that we have are 40490 through 40799. And we have a vermilionectomy, code 40500. This is a shaving of the lip. It's the vermilion border, so it's between the lip and the mucosal surface of the mouth, right here. That little piece that holds the, you know, if you go like this, right there. You will also find large defects. Those are covered by codes 40510 through 40527. These are your repaired with procedures such as a transverse wedge excision, which is code 40510. You also have the chyloplasty, which is lip repair. There's a full thickness repair, which is 40650 through 40654. Then you have a cleft lip repair, 40700 through 40761. So on page 255, the kind of words that I would highlight would be things such as biopsy, lip shave, excision, primary closure, linear closure, reconstruction, local flap, cross lip flap. Down under repair, the words that I would highlight would be partial or complete, unilateral, bilateral, primary, secondary, over under incision, over on codes 40800, drainage, simple, complicated, removal, foreign body, simple, complicated. For under excision and destruction, biopsy, excision of lesion, simple, complex, excision of mucosa, excision of frenum, destruction of lesion. What is the frenum? The frenum is the piece that, when you lift up your tongue, it's just like this piece that holds the lip to the gum. Underneath the tongue, that's the frenum. That little piece of skin that you see when you put your tongue out. Okay, that's your frenum. So, codes 41000 on page 256, the tongue and floor of mouth. These are incision and drainage codes. And the incision and drainage...
That one? I didn't hear that one. What was the tongue and floor and mouth is what you were on?
Yes, 41000 through 41599. These are your incision and drainage codes, and what they are based on is sublingual. What is sublingual?
Under the tongue.
Right. So I would write that in your book. Sublingual, under the tongue, right there on code 41000. All right, for code 41005. 41005. Then we have 41008, submandibular. What's submandibular? That's below the lower jaw, under the mandibular. So, mandibular, submandibular. 41009, masticator space. What's the masticator space? It's the floor of the mouth to the hyoid bone. 41015, extraoral. Extraoral is outside of the mouth. It's the incision and drainage of the abscess, cyst, hematoma on floor of the mouth. Then we have the dentoalveolar structures and palate and uvula. Over on page 257 in your CPT book. The dentoalveolar structures are codes 41800 through 41899. This is the bone and soft structures of the mouth. Bone is osseous. The bone is what anchors the teeth in the gums, right? Then we have the palate and the uvula. Codes 42000 through 42299. What is the palate? The palate is the roof of the mouth. What is the uvula? That is that pendulous structure at the back of the throat. Turn to page 258 in your CPT book. Then we have the salivary glands and the ducts, 42300 through 42699. You have 3 salivary glands. What are they? Page 258 in your CPT book. The 3 salivary glands. The first one is the parotid.
Parotid, submaxillary, and where's the other one? I don't see.
You have the parotid, the
Mandibular?
submandibular, and the sublingual. So those are the types of words I would highlight. Parotid, submandibular, and sublingual. And then your codes are divided initially by the gland. And then underneath excision in your CPT book, is it a biopsy? Again, sublingual, parotid, submandibular. Underneath repair, same thing. Is it parotid, submandibular? Over on the next column, underneath other procedures, highlight injection. Highlight the parenthetical note for radiological supervision and interpretation of use 70390. Highlight 42699. For your codes 42700 through 42999, these codes cover the pharynx, the adenoids, and the tonsils. Next to incision, I want you to write that we presume it is unilateral. Presume it is unilateral. Your incision codes are initially divided upon approach. So is it intraoral or external? Do you see those words in your codes? Extraoral or external. Intraoral or external. So again, these codes are divided by approach, intraoral or external. The tonsillectomy and the adenoidectomy would be codes 42820 through 42836. 42820 through 42836. Again, you want to know, is it a tonsillectomy or an adenoidectomy? Is it primary or secondary? When they tell you it's secondary, it's because it was a regrowth. So when you find secondary, right next to it, regrowth. And make yourself a note that talks about these codes being based on gland and age. So your codes 42820 through 42842 are all based on gland and age. For code 42960, page 259 in your CPT book, you want to write next to that modifier 78 question mark. Who can tell me why? Looking at that code descriptor, why would we want to use a modifier 78 possibly?
Because they have a hemorrhage, and then it could be primary, being the original, or secondary to another procedure.
They might have to go back in the operating room. Exactly. Okay, underneath esophagus. Your esophagus codes 43020 through 43499 is going to be based on the approach. So is it incision or excision? And then what part of the anatomy? Cervical, thoracic, abdominal, endoscopy. Okay? So those are the types of things I would highlight. Cervical, thoracic, abdominal endoscopy.
Could you give me the code again?
We're on codes 43020 through 43499. Page 259 in your CPT book.
Okay.
You're going to code the esophageal dilation. Number 1, you want to know the device or the method that they use. So it should tell you right there in the codes. Then, how does each device work? And 3, whether the dilation was endoscopic or non-endoscopic. And also keep in mind that a diagnostic endoscopy always is included in a surgical endoscopy.
And you said know whether it was endoscopic or what was the last one?
Non-endoscopic.
Non-endoscopic.
So diagnostic endoscopy is always included in a surgical?
In a surgical. Diagnostic endoscopy always included in surgical endoscopy. Now, we learned early on when we do an endoscopy, we're going to code to the furthest extent. Okay? On page 261, next to code 43200, make yourself a note that this is a basic endoscopy, a basic endo. And now at the bottom of the right-hand column, just put a star or an asterisk and write yourself a note that says the higher the code, the more intense. And then turn to page 262. On code 43215, highlight removal of foreign body. For code 43216, highlight tumor, biopsy forceps. And 43217, snare technique. For code 43227, highlight control of bleeding. For code 43235, put a note next to that somewhere, that upper gastrointestinal endoscopy. And it shows you actually what that procedure, how they do it right there in the illustration. For code 43239, highlight biopsy. 43246, highlight percutaneous gastrostomy tube. 43246, highlight percutaneous gastrostomy tube. On page 265, the parenthetical note for non-endoscopic percutaneous placement of gastrostomy tube, use 49440, and make yourself a note next to it that this is through the skin. Page 4, CPT 43248, highlight insertion of guide wire. (43249), highlight balloon dilation. Code 43250, hut biopsy forceps. Code 43251, snare technique. Code 43255, control of bleeding. On page 266, next to code 43257, gastroesophageal reflux disease, highlight that, and over to the left of it, write for GERD, G-E-R-D.
Where is that? Sorry. I got lost.
43257. Code 43257. On page 268, next to laparoscopy, right through abdomen. On page 270 in your CPT book, next to manipulation. Next to manipulation, write no scope used. And highlight dilation of esophagus. For your stomach, you're going to use codes 43500 through 43999. This is where you will see the gastric bypass performed for people who are morbidly obese. You have many different types, such as an RNY. They might be performed via laparoscope. On page 271, code 43752, highlight naso or orogastric tube placement.
We gotta go the other way.
On page 272, for code 43760, highlight change of gastrostomy tube. For code 43761, highlight repositioning of a naso or orogastric feeding tube. Your bariatric surgery codes fall under 43770 through 43775. Again, this is a gastric restrictive device, such as a band. Your intestines on page 274. you're going to find that separate procedures are common in this section. Your colostomies will always be bundled with a major procedure unless the code states otherwise. Your small intestine extends for 20 feet from the pyloric sphincter to the first part of the large intestine. The large intestine extends from end of the ileum to the anus. And there's 4 parts: the cecum, the colon, the sigmoid colon, and the rectum. Also, same here as in last chapter, the diagnostic part is bundled into the surgical. Okay? So if it's a diagnostic, it will be bundled into the surgical. And again, we're going to code to the furthest extent of the procedure. And if you turn the page to 276, you can actually see some illustrations of the stomach and the colon. But let's talk about some terminology, endoscopy terminology. Your notes will define specific terminology. Your code descriptions will be specific regarding the technique and the depth of the scope. So esophagoscopy is the esophagus only. A esophagogastroscopy is the esophagus to pass the diaphragm. And then the esophagogastroduodenoscopy is the esophagus to be on the pyloric channel. So again, you're going to break the words down to how far they go. Make sure that you're reading your notes preceding each section if you have notes. A sigmoidoscopy is the entire rectum, sigmoid colon, and may include part of the descending colon. There's actually up to 26 inches or 26 to 60 centimeters that is visualized. Yeah. The proctosigmoidoscopy is the rectum and sigmoid colon. And a colonoscopy is the entire colon, rectum to the cecum, and it may include the terminal ileum more than 60 centimeters visualized, or 53 inches. So if you look at that picture on page 276, and you think about how in the world do they do a sigmoidoscopy? That has to be pretty delicate work to get that scope, winding and doing all of that. So for a colonoscopy, when we talk about colon procedures and screening, for a colonoscopy procedure, you want to determine how it was performed. Was it through a colostomy? Was it through a colotomy? Or was it through the rectum? For your colorectal screenings, look at your HCPCS book. So pull out your HCPCS books. One of the few times we will use our HCPCS book. Now your HCPCS book, you want to tab that too. There's a section in there for modifiers. Okay? And turn to G0104.
Did you say
G.
G0104 or
Yep.
10?
G0104. And it tells you right there, colorectal cancer screening, flexible sigmoidoscopy. Now, what you also want to do is in your CPT book, this is where you want to cross-reference your HCPC book. So over on page 280, they have the colonoscopies. And you want to make yourself a note at the bottom of the page. Hold on just a minute. All right, page 283, sorry. (283) starts endoscopy, and it goes into the proctosigmoidoscopy, the sigmoidoscopy, and the colonoscopy. And what you want to do is just make yourself a note that for screening, and you can put colorectal screening, you can put colonoscopy. Basically, you're going to use G codes for any type of screening for Medicare patients.
And you said where's those located? In the HCPCs?
The G codes are in your HCPC book.
G codes.
And you'll see that you have, 2 or 3 pages just on colonoscopies. And it's just a matter of remembering that for the screening itself, you're going to have to pay attention because you might use code G0104 all the way through G0122. You just need to know, is it a Medicare patient or a regular patient? So in your HCPC book, you can make yourself a note that it's for Medicare. Laparoscopy and endoscopy. Page 272. Laparoscopy and endoscopy, page 272 in your CPT book. Laparoscopy and endoscopy. You're going to have some subheadings under here that have both laparoscopy and endoscopy. Laparoscopy is from the outside, endoscopy is from the inside. So keep in mind, endoscopy views the inside. Laparoscopy is usually inserted through the umbilicus, where the people or physician views from the outside. And this talks about the bariatric surgeries. As we mentioned earlier, the gastric band. And then we have hemorrhoidectomies and fistulectomies. These codes start with 46200. Over on page 289. These are divided by the anatomy. For hemorrhoids and fistulectomies, what's the anatomy? The anatomy is either subcutaneous or submuscular. Subcutaneous is where there's no muscle involvement. Submuscular is the sphincter muscle. And when they talk about a complex fistulectomy, it would involve excision and incision of multiple fistulars. Over on page 296 and 297, the abdomen, peritoneum, and omentum. These are codes 49000 through 49999. You will see that these are laparoscopy. For laparoscopy, you will have either diagnostic or surgical. Underneath this, you will also see that there are repair categories that also contain hernia repair codes. Over on the page 297, next to laparoscopy, make yourself a note that this is diagnostic. 49320 is a diagnostic laparoscopy. And over on page 298, next to code 49321, this is surgical. Or just highlight surgical. Keep in mind with your hernia codes, these are divided on 4 things. What's the type? So the type might be inguinal or femoral. Is it initial repair or subsequent repair? What is the age of the patient? And then what is the clinical presentation? So if you're looking for hernias over on page 300, underneath the subheading repair, it talks about the hernia repair code in this section are categorized by type of hernia, inguinal, femoral, incisional. If it is bilateral, you would use a modifier 50. So make yourself a note, modifier 50 for bilateral. And look for those keywords I gave you, inguinal, femoral, incisional. What's the age? Is it initial? Is it subsequent? And then how are they presenting? Is it strangulated Or is it incarcerated? Strangulated is where the blood supply is cut off. Incarcerated is that it cannot be returned to the cavity. So you might have implantation of a mesh or prosthesis. And if that's the case, those would be reported separately. Again, pay attention to your coding tips throughout this section as well. Throughout the whole book, you have a whole bunch of coding tips. All right, let's go back a few pages and highlight and underline a few other things. On page 282. On page 282, next to excision, these three codes. You have 44950. That one is plain and simple and straightforward. Just a plain, simple, straight procedure. 44955 is at the time of another major procedure. It has a plus sign before it. It's an add-on code. And 44960, highlight ruptured appendix. On page 283, next to endoscopy, make yourself a note. How far did they go? You need to know, how far did they go? On page 284, the types of words I want you to highlight. Proctosigmoidoscopy. Dilation, biopsy, removal of foreign body, hot biopsy forceps, snare technique, control of bleeding, ablation, decompression, stent placement. Over on page 285, same words, biopsy, 45330 code, sigmoidoscopy, removal of foreign body, hot biopsy forceps, control of bleeding, directed submucosal injection, decompression, removal of tumor, snare technique, transendoscopic balloon dilation over on the right hand column, endoscopic, fine needle aspiration biopsy. Turn the page. So the same words on these two pages here. Removal of foreign body, biopsy, directed submucosal injection, control of bleeding, removal of tumor, hot biopsy forceps, removal of tumor, snare technique. On page 288, underneath repair, I want you to highlight the approaches, abdominal and perineal. Over on the right-hand column, underneath manipulation, highlight reduction and dilation and removal. And that takes care of highlighting for those two chapters. Any questions? Angel?
No?
Okay, let's take a quick 5 minutes and we'll come back and do some answers.
But by the time we're done, it's just my head. But I understand everything. It's not
Haha, hot chocolate. I think I'm the only one here. It's
Really?
like nobody building. The secretary's not even here tonight. You
Oh,
see the
boy.
librarian.
All right, so let's start with the textbook, chapter 22. Okay, number 1 is approach. Chapter 22. Number 1 is approach. 2, bacteria. 3, separate. So 1 is approach, 2 is bacteria, 3 is separate. 4, blood cell. 5, aspiration. 6, allogenic. 7, autologous. 8, limited. 9, surgical approach.
Oh,
10,
can you slow down?
sorry,
6, 7, I'm on 8.
limited.
Okay, yep.
9, surgical approach. And 10 is phrenic. P-H-R-E-N-I-C. Okay, number 11, 38380. 12, 38571. 13, 38765. 14, 39561. Diagnosis 198.89 with V10.42. 15, 38500 with diagnosis 202.81. 16, 38542. Diagnosis 193. 17, 38555. 228.1 is the diagnosis.
What was that again?
Sorry. 17 is 38555, diagnosis 228.1.
8. All right, thank you.
Yep. 18, 38562. Diagnosis 185. Number 19, 38790. Diagnosis 785.6. 20, 39400. Diagnosis 786.6. Let's go right to 23 and then we'll go into the workbook. Number 1 is mouth and anus. Number 2, gastroscope or endoscope. Three, diagnostic. 4, laparotomy. 5, reducible. Number 6, 49565. 7, 49582. 8, 40527. 9, 43135. 10, 44150. 11, 44361. 12, 45300. 13, 45331. Diagnosis 569.82. 14, 43245. Diagnosis 537.0. 15, 45385 and 45384. 16, 43249 and 43239. How did everyone do on those? Okay, let's do your workbook.
Okay.
All right, 22, chapter 22 workbook. I'm only going to do the even numbers. After I go through 1 through 33,
Right.
okay?
That one.
1 is K, 2 is B, 3E, 4F, 5G, 6A, 7D, 8H, 9I, 10J, 11C, 12L, 13F, 14G, 15B, 16A, 17H, 18D, 19C, 20E. 21 is M. 22C, 23J, 24F, 25D, 26H, 27L, 28A, 29K, 30I, 31G, 32E, 33B. $34. You should have 38792 with an RT modifier. Your diagnosis for this is going to be neoplasm of the breast, central portion, malignant primary, diagnosis code 174.1. (36) CPT 38305. Diagnoses 683-041.10. (38) CPT 38101. Diagnosis 282.64. (40) 39501. (42) 39560. (44) 38120. And number 46, the report. You should have 38120. Diagnoses 865.01 and E917.0. So far, so good? All right, 23. 1 is B. 2 is D. 3 is F. 4 is C. 5 is G. 6 H. 7 A. 8 E. 9 I. 10 B. 11 I. 12 G. 13 E. 14 C. 15 H. 16 F. 17 A. 18 D. Number 20, 42665. 22, 44020. 24, 40806. 26, 42809. 28, 44141. 30, 43770. 32, 41250. 34, 43282. 36, 44310. $38, 46040. 40, 45380. With V 76.51 and 211.3. Did you do the reports? Okay. So, Angel, I'm going to let you do the reports for homework.
Yep.
Yeah.
Attempt. Jeez.
All right, for next week, your assignments for next week. It's going to be 24 and 25. "24 is the urinary and male genital systems, and 25 is the female systems." Okay? Again, read the chapter, do the in-chapter exercises, do the theory and practicals in both the workbook and the textbook. In the workbook, just the even numbers. And email me anytime, any questions you have, or bring them to class for next time. Again, we only have about 4 more weeks. We should be done by the end of March. Okay? So, you should have all received the exam application for the AAPC. I want you to go on to the aapc.com website to try and locate an exam. The goal is that you will be ready to sit for your exam 30 days after class. They usually have them in Bangor, Lewiston, Portland, Sanford, okay? So you should have no problem trying to find an exam location. The exam application gets completed and sent to Amy. She is the one that sets up the exam for you because it's part of your course fee. So you're going to give her 2 options, so that if she can't get you into the first one, she can get you into the second one. As we get closer, we will talk more about what to expect. One of our last gatherings will be an exam prep, and then we will do a mock exam. So I like to do a mock exam within, the first 6 weeks after class. I usually schedule it for a Saturday. All right. Any questions?
Do you have any idea of where you'll do the mock exam?
No.
Yeah, not
It's wherever I can get room.
Right.
Honestly. Any questions, Angel?
No?
Okay. What's your takeaway from tonight, Angel?
I don't want to work in the hard codes. It's a lot of information and a lot of codes that you have to sequence stuff with and memorize and document so you remember it. I just put it right in my book, so I know. It's just easier when I go back there, so then it just starts becoming normal.
Good. How about you, Emily?
I mean, pay attention to my modifiers. That's my thing. Well, I know I should, but...
Well, wait until we do path and lab and radiology. Okay? Radiology, this is the hard part with radiology, and we haven't gotten there yet. If we did, I apologize. It's in the code descriptor. If the code descriptor says right or left, you don't need the RT or the LT. If it's a paired organ, you don't need the RT or the LT. If it's in the note, you shouldn't have to use RT and LT. The sad truth is it depends on how the payer wants it. For this class, if you put an RT or an LT, I'm not gonna worry too much about it, okay? Because what it boils down to in the real world is, does the payer want to see RT or LT? And you're going to know by looking at the course guides, their billing guides. That's what it comes down to, really, okay? Surgeries, for hands and feet. You don't have to put RT and LT if you are putting a digit.
Right.
If you're putting the modifier for the digit, because the digit specifies if it's right or left.
Can you find that in your HCPCS book?
Or the front of your CPT book.
Mm.
All right, ladies. Same time next week. Thank you very much. I hope You have a great week.
Yes. Good night.
Good night.